Good morning or good afternoon, everyone. My name is Angie Grover. I'm the co-founder and COO for Metopio, and we're going to get started in just a moment. I'm going to let everybody log on to the webinar. We like to start our webinars with a poll. So I'm going to launch a poll here so we can have a discussion and learn a little bit more about your experience before we get started. So really, we are interested in what are some of your biggest challenges in completing your CHNA. So go ahead and take that poll. I'll let that run as people start joining the webinar, and we'll get started here just in a few minutes. All right, welcome everyone. Again, I'm Angie Grover. I'm co-founder and COO for Metopio. I just want to do a bit of quick housekeeping. We have a poll up and running, so if you're just joining us, go ahead and take that. I'll repeat that one more time before we get started with our webinar. For today's webinar, we will have the chat on, and our team will be managing that. So if you have sunny, breezy. It's 10:00. Sorry about that. If you have questions during the webinar, go ahead and put them in the chat. We will also have the audience muted, and we'll try to save some time for questions at the end. We are going to keep this to 30 minutes. So if we don't get to your question, we'll follow up with you directly. Both the slides and the recording will be distributed after today's call. And I'll do one last call for the poll. But first, I just want to thank you for taking the time to join with us today. The rapidly changing policy environment may directly impact you, but it certainly impacts many of the partners we work with every day. So we're going to try and keep this to 30 minutes. It's a jam-packed half hour, and highlight some of the ways that you can expedite how you look at your community in a deep and meaningful way, because we really believe that community assessments are not a nice to have, but a need to have, so we can understand what is driving poor health outcomes and be strategic with our time and resources. So at Metopio, we leverage advanced analytics, AI-driven tools, and automation to simplify complex tasks while making health assessments simpler and more efficient, so you have time to focus on what really matters, which is community engagement. We believe data is more than numbers. It's a roadmap to solving real-world problems. So across the country, we work with hospitals and public health departments, lots of collaboratives who all share the vision, and we're using our platform to advance health outcomes and increase and build healthier and more resilient communities. So I'm going to wrap up this poll and share the results. So Nicole, it looks like folks are really looking for some ways to engage stakeholders and community members, as well as writing and formatting the final report and managing some of these timelines, which we'll get to. So with that, I am excited to have Nicole Edmonds, Director of Community Benefit with Baylor Scott White Health, to join us today. Nicole has deep commitment to working with communities. She leads the community health team at Baylor Scott White Health. And not only that, but she lends her expertise in the classroom by teaching the next generation of leaders at DePaul University. I'm so thrilled to have you today, Nicole, join us. And as we get started, I know you've been working on community health assessments for almost a decade. We won't count the years, but I wanted to dive in first and have you reflect back on, just take a minute or two and talk about how you've done community health assessments in the past, so we can frame our discussion about technology and time-saving tips going forward.
Sure. Thank you, Angie. So first, obviously, in terms of planning, we established our, a detailed CHNA timeline, and then we identified all of our partners or our vendors that we were going to be utilizing for that CHNA process. Also, during the planning phase, we determined any collaborative, whether that be hospital collaborative or health department CHNA collaborative, where maybe our service areas overlapped or we had a similar or the same CHNA timeline. Of course, if there's room for collaboration on CHNAs, that's always a good thing, because, you're decreasing community burnout by, multiple organizations or hospitals doing the same surveys for the same communities. And then also you're able to align your data a little bit better for those collaboratives. So during the planning phase, we always determined and identified collaboratives, or whether that be hospital or health department collaboratives, that we could engage with and partner with to conduct the CHNA. Also in the planning phase, we identified data sources. So that includes primary and secondary data. Where will we get all of this data from? You know, pre-Metopio, this took quite a chunk of time because you literally were looking at, you know, however you defined your community, whether that was by hospital service area or by county, and you were looking for various data sources and secondary data sources in terms of collecting the data that you needed for that CHNA for your respective community. And then also in the planning phase, we established details of the secondary data collection methodology. So this included things like focus groups, key informant interviews, which populations we wanted to target. And historically, this took a bunch of time because you were having to identify community partners for those focus groups, where you were going to hold those focus groups, questions for the focus groups, community partners that could collaborate you and support those focus groups. Same thing for key informant interviews, just taking time to coordinate and schedule community members and leaders and hospital leaders for key informant interviews. So I'd say between identifying data sources and establishing your secondary data collection methodology, it took a ton of time just to do those two things in the planning phase. And then we jumped into data collection and analysis after those details of secondary data collection and primary data collection were figured out. In terms of implementation for the CHNA process, implementation of primary data collection strategies. So we implemented focus groups, key informant interviews, and again, I'll just reiterate, this took a chunk of time because we were literally holding the focus groups in person. And so we were having to travel, drive to each of the communities to hold each of those focus groups. So that took a nice chunk of time to do. We also, during the implementation phase of the CHNA, of course, we analyzed the primary and secondary data to identify key themes. We also compared secondary data themes to primary data themes. So the data that we collected from focus groups and the data that was collected as a result of that secondary data, we would compare those to pull out key themes that we were seeing in both of them and each of them. And then we identified the top health needs or themes to present to hospital and community leaders to go over the top health needs for the respective CHNA community. And typically, pre-COVID, when I first started this work in 2016, we actually had to pull, not only did we pull all of the data ourselves for the secondary data and the primary data, we created data books ourselves. So we literally created the reports, the data reports, and then we printed out those reports for each of our, we call them council members, for each of our CHNA council members to review the top health needs and then prioritize. And historically, we've always had 2 one-hour meetings. One is for the data review, so reviewing the top health needs. And then the second meeting was for the prioritization phase of things. So historically, that is how we kind of conducted the CHNA. I'll just add too, that I think in total, maybe it took over about 250 hours total between, again, secondary data collection, primary data collection, and then just putting together those data books for our hospital and community leaders to review.
Yeah, I think that's one of the things. I just launched a poll. We're curious how long you take to do your CHNA. You know, typically it's 12 to 18 months with planning from start to finish. And so I think what we want to focus the rest of our time on are just what are a few pieces of technology that have helped you. We'll start with data and just what have you been able to do and how has it helped you move into quicker, more deeper understanding of your community. And I wanted to talk about data first, and then we'll talk about community engagement because that's what so many folks are interested in.
Sure. So the first thing that comes to mind in terms of, you know, leveraging technology and our partnership with Metopio and just making data more accessible is Metopio database includes benchmarks to determine disparities and significant differences in, you know, disease rates and demographically, whether you're looking at socioeconomic status. And so literally with the click of a button, you're able to look at differences of your disease rates or social determinants of health, those rates by benchmarking the data with the county or the state or the US. And so again, that used to take us quite a bit of time to do that because you were pulling the data from various sources and having to benchmark it yourself. Metopio database, literally a click of a button, you're able to pull in different rates from across different levels, including, your CHNA community, county, state, and then also the U.S. Also, you can utilize or analyze data with a historical lens. Once again, a click of a button through Metopio. So you're able to look at rates over time. So like one of the things that we looked at as a part of the 2025 CHNA with Metopio was our food insecurity rates and even mental health rates. And we were able to track over time how those rates have increased or decreased. Whereas, our partnership or our CHNA pre-Metopio, we would have had to pull that data from different sources to look at the increases or decreases over time. I'll also mention that using health themes identified through secondary data, we were able to run a qualitative analysis around health themes to align with secondary data analysis. And so when we pulled secondary data, we were able to utilize our surveys to kind of fill in the gaps or dig deeper into certain health themes that we were seeing from secondary data. And yeah, this slide just shows we partnered with Metopio. When we did these community surveys, we were able to kind of upload all of the data and pull out key health themes that were similar to what we were seeing in the secondary data, so that we could present within the top health themes that were presented to our hospital leadership and community leadership. We were able to have them see the alignment between the secondary data that was pulled in those health themes and the primary data that was pulled in those health themes.
Yeah, and this becomes a repository so that you can go back to it. It doesn't sit kind of off-site. This is something that you can access at any time and pull up to answer questions as they come your way, which is kind of one of the things we're trying to build, is that cyclical nature, so that all the data and analysis that you're doing doesn't go to waste. And so I think one of the things we wanted to talk, one of the top requests from our community today, and being mindful of time, is, how did you leverage the tools and technology you currently have to increase and enhance that community engagement? I know you guys did a bunch of cool stuff.
Sure. So one of the ways that we were able to leverage technology to enhance community engagement and make sure that we had diverse kind of stakeholders, feedback from diverse stakeholders in terms of the focus groups and the key informant interviews, we were able to, this kind of goes back to using those virtual spaces, so Teams and Zoom, to hold our focus groups and key informant interviews. Of course, there are some times where, it's not appropriate to hold focus groups on virtual platforms. But I'll say about 95% of our focus groups were held virtually. And again, we have 19 CHNA communities, and we cover over 50 hospitals and joint ventures. So we cover a very large geography. And we were able to do quite a few focus groups for each of those CHNA communities because we use virtual spaces. So the travel time was cut out. We didn't have to coordinate to find spaces, also paying to find a space. I'll say the last CHNA that I did back in 2022, when we held in-person focus groups, we actually paid for spaces to hold those focus groups. So utilizing Zoom, Teams, those virtual platforms to hold focus groups, that was one way that we definitely leveraged technology to make sure that we engaged our stakeholders across all of 19 CHNA communities. Also, 98% of our community surveys were assessed and completed online. So that, primary data, a lot of that was collected via an online survey. There were a few folks, whether it was because of technology or because maybe they were seniors, and it was just easier for them to fill out a paper survey. We've made that available to them, but the bulk of individuals residing in our CHNA communities completed the survey online. And then finally, a really cool feature that we were able to leverage through Metopio was the AI-led key informant interviews. And so for our key informant interviews, we mostly targeted internal, so Baylor Scott White Health leaders. And so that includes our hospital presidents and our COOs, our CFOs. And so as you all can imagine, their schedules are very tight. And so we gave them the option to be able to have complete the AI-led interviews, key informant interviews, which was huge because then they were able to complete it either, early in the morning before they started their workday, or later in the evening, or even during the weekends. And so we were able to get more engagement from our hospital leaders, including our presidents, through offering that AI-led key informant tool.
And then do you just want to touch on the prioritization? Because I think these are a lot of tools that people
Sure.
might already have.
Sure. So I think I mentioned this earlier, but we're in the middle of our 2025 CHNA right now. And so we've completed all the data collection analysis. We've presented the top health themes or top health needs to each of our groups or committees in the 19 CHNA communities. So we held those presentations virtually where we literally walked them through, here are the top health needs of your community or the top health themes. It was a lot of data in a very short period of time. So within an hour, we covered about, I want to say 70 slides. And so as you can imagine, to kind of throw in prioritization at the ends of that is really difficult for folks because they're still thinking through all the data that was just presented and all of the experiences that they have with their patients or the community. They also want to have, and I'll speak specifically for our hospital leaders and presidents, some of the feedback that we got was they want to have those internal conversations about the data that was just presented to their kind of leadership teams and departments and get feedback before they vote on the final health priorities. So we actually did not have them vote on priorities in that meeting. We focused on the data and discussion and then questions about that data. And then we followed that via email with all of the committee members. We shared the data slides so that they had time to dissect all of that data, review the slides in their own time, again, have those internal meetings. And then they were able to vote via the polls feature on Outlook. So literally in the body of the email, what you see here on this slide is the top health teams that were presented with all of that data. And they were able to have those internal meetings and then click on the email and vote via the polls feature in Outlook, which went directly to us. And we were able to see, the percentages of what had the most votes and our final health priorities. So I'll say that was a huge time saver because even, I'll say back in the day, but 2016 CHNA, we held two back-to-back, hour-long meetings. One was to review the data, the other one was to prioritize. So this cut out a whole, need to have another 1 hour meeting and coordinate schedules with our leaders.
Yeah, and I think, doing all the MAP 2.0 assessments, whether you're doing context or status assessment or partner assessment, part of what you've demonstrated with all the different technology you've deployed is that you can get deeper and broader by giving people more options, right? So a lot of people are busy these days. I think what we've learned during COVID is that people are willing to do things online if you are approaching them with appropriate language. If you're, like you said, I love the idea that you really dug into the data with your prioritization groups and then let them digest it and then vote. So I think, those are ways that we can really look at. And then the time you free up that you get people to engage through technology, you can spend going to those more vulnerable or maybe those more underrepresented communities, whether it be seniors or an immigrant community or somebody else. The whole idea is that if you can find ways to save time, you can spend more time getting deeper into those communities that you want to make sure that are represented.
Absolutely.
So we also just wanted to touch a little bit on data visualization. And because this is all on the platform, I know that you've used this to track progress and a few other things. Do you want to just touch on this and we can get into some top tips next?
Sure. So the data visualization, has been very helpful because, again, it's a click of a button. You're able to pull different data insights into your CHNA process. And I don't know if I'm jumping ahead here, Angie, so forgive me, but you're also able to utilize the insights and the data visualization, visualization to share with even our health equity committees across the system that, we align the work with the CHNA, but they're kind of working on other things that are internal facing, that are health disparities. But a lot of the data visualization that we use for the CHNA, they also can use and leverage. And so it's just nice to have this database where you're able to refer back, or I'll even say also that during our presentations where we presented the top health needs and themes in each of the CHNA communities to our committees, we actually had a lot of dialogue and discussion about additional data that they wanted to see. So for example, we looked at mental health. And so they asked questions like, well, can we get a breakdown by race ethnicity in terms of mental health rates? I don't know, ED rates due to mental health issues, or for various indicators. They ask for various breakdowns. Can we get them? Can we get different benchmarks? And so we literally, it was just a click of a button. So we were able to go into this data visualization tool in the Metopio database and literally add the additional data into the slides. And so that way they had all of the additional data when the slides were sent out via email before they prioritized. And so it's just great to have literally, I know I keep saying this, but a click of a button and you have all this data at your disposal to be able to pull in and provide additional insights to your hospital leaders and community leaders.
Yeah, it's great to do that real time. I appreciate that. So let's just do a quick round robin or a lightning round on some of your top time-saving tips. I'm tongue-tied myself. Some of the ways that you think that by using technology and the things we've talked to, let's recap that, and then we'll talk about how we move into real results.
Sounds good. So, and I'll go through this really fast. I'm looking at the time, so I know we want time for questions as well. So I'll say one tip is to reduce time to getting the right data. Again, with Metopio, and not to just reiterate Metopio, but truly with Metopio, you have all of your data in one place. And so as Angie just showed, you have your data visualizations in one place, you have your benchmarks in one place, you're able to stratify data by race, ethnicity. And so again, with the click of the button, everything's in one place, easily accessible, and frees up your capacity to be able to focus on other components of the CHNA or even other things that you may be working on at the time. And then also the data platform is regularly updated, so you're not having to go to those secondary data resources yourself and figure out, you know, has the data been updated, has it not? It's updated regularly, automatically, and so when you click into the database, it's going to show you the most up-to-date data. Another tip, increase participation from diverse stakeholders. So again, less time spent collecting and analyzing secondary data. So the less time you have, you know, you're spending more time kind of increasing your engagement from your communities and diversifying your stakeholders in terms of hearing back regarding the health and the social needs of your community. And you're able to do that because you have free time, because you have this Metopio database that you're able to just pull data from. And so again, we leverage Zoom and Teams to gather community input. We were able to kind of engage more community partners. We have 19 CHNA communities, over 50 hospitals. So as you can imagine, there are literally hundreds of community partners that we wanted to engage. So we were able to leverage Zoom and Teams to make sure we engage them across our 19 CHNA communities. Third tip, align qualitative and quantitative data collection. So you can use visualization, the tool that we just showed where we were able to populate the key themes from the survey results, where we were able to look at kind of key themes and align it with our secondary key themes and make that kind of visual in terms of looking at the data. Super helpful for our committees when they looked at what are the top health needs and how does this data, how does the secondary data align with the primary data, which is the data that we collected directly from the community. In terms of leveraging insights, super valuable information is collected as a part of the CHNA process. And so I just mentioned that across the system, Baylor Scott White Health system, we have hospital health equity committees. We also have a system health equity committee where they actually utilize a lot of our insights that were collected as a part of the CHNA process as proxy data for their work, because the real data that was supposed to be, or I shouldn't say supposed to be, can be collected from hospitals was not available. And so we had to use proxy data from the CHNA process and insights to help them build out their health equity plans and health disparities. And I'll also mention very quickly that we've worked with Metopio to also pull in health equity insights the population and community health level for those same health equity committees and system committees to help them build out data-informed strategies where they were able to understand the health disparities, the most affected populations, and then also what we should focus on in terms of what was the top non-medical driver of health, what was the top health need. And then finally, the top, in terms of top time-saving tips, collaborate wherever possible. I talked about this earlier, but I cannot reiterate enough that many institutions, including health departments and hospitals, healthcare systems, and some Medicaid health plans, we are all required to do CHAs or CHNAs. And so wherever possible, wherever there is an overlap in service area or there is an overlap in CHNA timeline, we really try to collaborate with those various agencies so that we do not, burn the community out in terms of asking them to participate in multiple surveys or, asking them to participate in multiple focus groups. So wherever possible, collaborate, even if it's not on the entire, CHNA process. For the greater Austin region, for example, we were able to share our Metopio survey results with them. So we didn't collaborate on the entire process, but we were able to share data back and forth that we all utilized as a part of our CHNA process.
Yeah, and that goes to a question Tracy just asked about how do you collaborate or who takes the lead when you have different CHNA cycles. And so I think, what we're finding across the country is that a lot of public health departments and hospital systems are working together on a 3-year cycle, even though public health departments under the FAB accreditation is required every 5 years. Hospital by IRS is every 3 years. Mental health agencies are also doing community needs assessments. And in California, they're aligning Medicaid payers with public health and hospitals. So I think it does take a little bit of coordination, but as Nicole has said, if you have all this data in one place, it's very easy to press a button and get a new assessment. So even if you have to do it off cycle, we do have some of our hospital systems who are just running this once a year because it's so easy to update and they want to look at how they're doing year over year. So there's a couple different ways you can approach that. But I think typically when things are off cycle, you take the lead of deciding which cycle you're going to do. And we've seen a lot of success in collaborations that way. And I just want to touch real quick. Nicole did dive into leveraging insights. And this is one of the projects that we worked on together to look at majority minority communities and what the disparities were in the health outcomes. And so, Nicole, I'm just going to go to the next slide and run that really quick. But if you want to just dive in a little bit deeper on that.
Sure. So again, we have health equity committees across our system for each of the hospitals. We also have a system-led health equity committee, and they are really working to fulfill some of the standards for a lot of our accrediting institutions. So including like the Joint Commission, CMS, around making sure that we address health disparities of the healthcare system. And so work with Metopio, Angie, they were awesome at collecting various insights and indicators, including the social vulnerability index, to see which communities within each of our service areas were most impacted or affected by various non-medical drivers of health and health issues. Also looking at demographics to understand from a cultural competency point of view how the health disparities affected our service areas. And so we literally developed little data books for each of our hospitals' health equity committees that they were able to utilize and leverage that data to not only understand their communities, but also, again, develop and implement data-informed health equity strategies.
And so what we just showed here really quickly was the ability to rank by the demographics as well as the hardship index and some of those key outcomes to really understand what's happening in these communities and how the outcomes might be disparate based on the population. That ranking table is really handy. And again, you can just pull it up and shift the rank depending on the variable that you're concerned about. So I know we're running up right against time, so I don't know if there are any questions from the audience. What we wanted to show here is just the ability, and I'm so thankful that Nicole kind of set this up. The traditional way of doing your CHA or your CHNA really can take 12 to 18 months. But by using technology and really being able to leverage a platform like Metopio and the commitment we have, or some of the tools you might already have, such as Zoom or Teams, you can really reduce it. And as you see on this slide, we really want to free up your time to get into the community. Make sure you're reflecting that lived experience and being able to, by recording those key informant interviews, really, have the language represented of the individuals you're talking to and have that be a deep and meaningful insight you can leverage into all of your work. So I know that I answered a couple questions that came across the transom as we went through our presentation today. Both Nicole and I are happy to share our experience and really some tips and tricks for how we've expedited this process to help you get meaningful insights. And as I said, this is being recorded and will be released to everyone on the call, as well as the slides and some insights that we've developed from working together. So I really, again, want to reiterate, I'm going to see if there's any last questions in here. Really want to reiterate that we're here to support you. We think community needs assessments are necessary to drive the work. And as Nicole demonstrated, it elevates community health throughout the entire healthcare decision-making process. So we thank you for all your time today. Nicole, thank you so much. I know it's stormy and where you are in Dallas, so I appreciate you making the time to join us today and share all of your expertise. The last poll I just want to launch is we are going to continue our conversation about the future of CHNAs. And the next conversation is going to be really interesting because it's going to focus on surveys, community surveys, and how you can, how people are thinking about doing community surveys. So do you do the full community survey with statistically valid samples? Do you do a representative sample? Do you not do them at all and just focus on key informant interviews? Do you use AI to assist you in getting those key informant surveys? I think there's a lot of conversations about how we move forward and make sure that community voice is at the center of our assessments. We'd love for you to join us because we want to have a really robust discussion and find how you're doing this, as well as give you some options that might actually help enhance how you do your community surveys. So again, thank you for your time today. Have a wonderful day.